Men over 60, I need your full attention right now. 3 out of every 4 men your age are quietly losing ground to prostate problems. Weak stream. Constant bathroom trips. Nights broken into pieces. And here's what keeps me up at night as a urologist. Almost nobody tells you that 3 simple daily habits, completely natural, backed by real science, could slow this down or even reverse it. But if you wait too long, those symptoms stop being occasional annoyances and start stealing your independence, your energy, and your confidence as a man. I'm Dr. Sophia Laurent. I've spent over 2 decades helping men protect their prostate, improve circulation, and restore vitality without dependency on medications that only mask the problem. And today, I'm going to walk you through 3 habits that can change everything. In the next 12 minutes, you'll learn exactly what to do, when to do it, and why it works. Stay with me until the end because I'll show you how these 3 habits work together like a shield, and which one delivers the fastest relief. Some of what I share will surprise you. One habit involves something you do every single day, but probably at the wrong time. Another seems too simple to matter, but the science behind it is undeniable. And the third? It touches on something most men are too embarrassed to talk about, but it's absolutely critical. Let me start by telling you why this matters so much. Your prostate sits right beneath your bladder, wrapped around the tube that carries urine out of your body. For most of your life, it's about the size of a walnut, quiet, unnoticed, doing its job without complaint. But after 60, something shifts. Hormones change. Testosterone starts converting into a more aggressive form called DHT, and that triggers your prostate to grow. This condition is called benign prostatic hyperplasia, or BPH. By 60, about 6 out of 10 men have it. By 70, 7 out of 10. For some men, the growth is mild. For others, it becomes a daily battle. The prostate presses against the bladder and urethra, narrowing the passage. That's why your stream weakens. That's why you feel like you can never fully empty. And that's why you're waking up 2, 3, 4 times a night, dragging yourself to the bathroom, losing the deep restorative sleep your body desperately needs. Here's the part that frustrates me most. Most men think this is just aging. They think it's inevitable. They think they just have to live with it. But that's not true. Research from the Mayo Clinic, the National Institutes of Health, and urology journals around the world shows that lifestyle changes can dramatically slow prostate growth, reduce inflammation and improve symptoms. And I'm not talking about complicated protocols or expensive supplements. I'm talking about 3 daily habits that cost you nothing and fit into your life starting today. Think of your prostate like a garden. If you water it wrong, ignore the soil, and let weeds take over, everything suffers. But if you give it the right care, consistently, it thrives. That's what we're going to do together right now. Let's begin with the first habit, and this one catches almost every man off guard. It's about water. Now I know you're thinking, Dr. Laurent, everyone knows drinking water is important. Yes, that's true. But here's what most men get dangerously wrong. They don't drink enough during the day, and then they try to catch up at night. Let me paint you a picture. You wake up in the morning. You have coffee, maybe a little water with breakfast. Then the day rushes by. You're busy. You forget. You don't feel particularly thirsty because as we age, that thirst signal weakens. By evening, you realise you've barely had anything to drink all day. So what do? You chug a big glass of water before bed, maybe 2. You think you're being responsible hydrating your body, but you've just set yourself up for a terrible night. Here's why that's a disaster for your prostate. When you don't drink enough during the day, your urine becomes concentrated. It's dark, dense, packed with salts and irritants, and that concentrated urine does 2 harmful things at once. First, it irritates your bladder lining, making it more sensitive and reactive. Second, it inflames your prostate. Think of it like this. Imagine you're pouring strong acid into a delicate filter all day long. Over time, that filter gets raw, swollen, and less able to function smoothly. That's exactly what's happening inside your body. A study published in the Journal of Urology tracked men with BPH and found that those who drank less than 1.5 litres of water daily had significantly worse urinary symptoms. Urgency, weak flow, frequent nighttime trips. But when those same men increased their water intake and spread it evenly throughout the day, their symptoms improved within weeks. Let me tell you about Richard. He's 65, came into my office exhausted, frustrated, waking up 5 times a night. He thought he needed surgery. But when I asked him about his hydration habits, He admitted he barely drank during the day and then filled 2 big glasses right before bed. We made one change. Front-load his water in the morning and afternoon, then taper off after 6 p.m. Within a month, Richard was waking up once, maybe twice. His wife told me, "You gave me my husband back." He actually has energy again. This is what I call strategic hydration. It's not just how much you drink. It's when you drink. The goal is simple. Take in at least 70% of your daily fluids before 6 in the evening. That way, your prostate and bladder stay hydrated and healthy, but your nights remain uninterrupted. Research shows that men who adopt this timing strategy can reduce nighttime bathroom trips by up to 40%. Think about that. Almost cutting your disruptions in half with one small adjustment. So here's what I want you to do starting tomorrow morning. Keep a water bottle with you. Sip consistently through the morning and early afternoon. By 6 p.m, start tapering. 1 small glass with dinner is fine, but no more big gulps before bed. Your bladder and prostate will thank you. And hydration is just the foundation. Because even if you master this, there's another overlooked habit that quietly fuels prostate inflammation. And surprisingly, it has nothing to do with what you drink, but what you do right after you eat. That brings us to the second habit, and this one is so simple that most men dismiss it at first. Walking after meals. I can already hear some of you thinking, Dr. Laurent, how can something as ordinary as a walk really protect my prostate? Let me show you. I had a patient named Tom, 68 years old. He was waking up 6 times every night. His bladder always felt half full. He was exhausted, irritable, losing hope. He'd already tried medication with minimal relief. After reviewing his lifestyle, I gave him one prescription. Not a pill. A practice. Walk for 10 to 15 minutes after lunch and dinner. He looked at me like I was joking. But 2 weeks later, Tom came back with a grin. "Doctor, I'm only getting up twice a night now. I feel like a new man. Why does something so simple work so well?" It all comes down to circulation and inflammation. When you walk after a meal, your blood vessels open up. Oxygen-rich blood flows to your pelvic region, including your prostate. Think of your prostate like an engine. If oil doesn't circulate properly, friction builds and the engine overheats. In your body, poor circulation fuels inflammation, which worsens enlargement and urinary symptoms. But light walking is like turning on the pump. It keeps everything flowing smoothly, reducing swelling and irritation. And there's more. Walking after meals stabilizes your blood sugar. This is critical because poorly controlled blood sugar is strongly linked to prostate problems. High glucose fuels inflammation, damages blood vessels, and disrupts hormones. Research published in the journal Diabetes and Metabolic Syndrome showed that men with poor glucose control had more severe urinary symptoms and faster prostate growth. Here's another powerful benefit. Walking after meals reduces body-wide inflammation. A study in the Journal of Inflammation Research found that just 15 minutes of light walking after eating significantly lowered inflammatory markers in older adults. That's like flipping off the inflammation switch, not only in your prostate but also in your heart, joints and brain. Now, I'm not asking you to power walk or break a sweat. The goal isn't exercise intensity, it's movement consistency. Just 10 to 15 minutes at a comfortable pace after lunch and dinner is enough. You don't need fancy equipment. You don't even need a gym. All you need is to put one foot in front of the other. And here's a bonus. Walking after dinner improves digestion, reduces bloating, and helps you sleep more soundly. Better sleep means better prostate health. So here's my challenge to you tonight. Instead of sitting down on the couch after dinner, go for a short stroll around your block. Just 10 minutes. Then come back tomorrow and tell me in the comments if you tried it. Type 1 if you did, 0 if not yet. I want to see how many of you are taking action today. Hydration and walking may sound basic, but together they're incredibly powerful. And yet, there's still one more daily habit that might surprise you even more. It has to do with intimacy, hormones, and the quality, not just the quantity, of your sexual health. What I'm about to share may completely change the way you think about protecting your prostate. We've talked about hydration. We've talked about walking. Now let's turn to the third habit, the one that many men are shy to discuss, but absolutely critical for prostate health. Intimacy. For decades, doctors believed that frequent ejaculation, through sex or masturbation, was always beneficial for the prostate. In fact, a landmark Harvard study followed over 30,000 men for 2 decades, and found that those who ejaculated around 21 times a month had up to a 33% lower risk of prostate cancer. That study made headlines and shaped medical thinking for years. But here's what newer science tells us. Not all forms of sexual activity are equal. Partnered intimacy and solo stimulation may both lead to ejaculation, but their effects on your body, especially your prostate, are very different. Let me explain. When you engage in partnered intimacy, your body experiences a powerful cascade of positive effects. Your brain releases oxytocin, the bonding hormone. Cortisol, your stress hormone, drops. Blood circulation in your pelvic floor improves. And your prostate benefits from relaxation and reduced inflammation. All of this creates a protective environment for your urinary system and your hormones. Masturbation, on the other hand, does not provide the same hormonal and emotional balance. When it becomes excessive or purely habitual, it can lead to pelvic floor tension and irritation of the prostate. A study published in BJU International found that older men who relied heavily on frequent solo stimulation were more likely to report urinary tract symptoms than men who maintained partnered intimacy. Let me give you an example from my practice. George, 72 years old, came to me complaining of worsening urgency and weak flow. He admitted that after his wife passed, he relied mostly on solo stimulation. While it gave temporary relief, it didn't help his symptoms long term. We worked on strategies to address both his pelvic health and his emotional well-being, encouraging gentle intimacy when he entered a new relationship, along with pelvic floor relaxation techniques. Within months, his urinary comfort improved, and his confidence as a man returned. Think of it this way. Sex with a partner is like a balanced meal. It nourishes your body on many levels. Masturbation is more like a snack. It can take the edge off, but it doesn't give you the same full nutrition. Occasional snacks are fine, but for long-term health you need the meal. Now I want to be clear. Occasional masturbation is not harmful, but the idea that more ejaculations, no matter how, are always better is outdated. What matters most is the quality of intimacy. Connection, relaxation, circulation, not just the count. So if you have a partner, maintaining intimacy is one of the best gifts you can give your prostate. If you don't, talk with your doctor about pelvic floor exercises, safe therapies to boost circulation, and ways to support your emotional health. Intimacy comes in many forms, but your prostate thrives most when it's part of a balanced, connected life. And remember, these 3 habits, hydration, walking, and intimacy, don't work in isolation. Their real power comes when they work together, forming a shield that protects not only your prostate, but your independence, energy, and dignity. Let's bring it all together. Your prostate may be small, but its impact on your daily life is enormous. And the good news is this: you are not powerless. Even after 60, you can make choices that protect this vital gland, reduce frustrating symptoms, and restore your energy and confidence. Let's quickly review the 3 habits that can change everything. Habit 1, strategic hydration. Not just drinking more water, but drinking it at the right times. Fill up during the morning and afternoon. Taper off after dinner. This simple shift reduces bladder irritation, prevents concentrated urine from inflaming your prostate, and cuts down those exhausting nighttime bathroom trips. Habit 2, walking after meals. 10 to 15 minutes of light walking after lunch and dinner boosts circulation to your pelvic region, reduces inflammation, stabilizes blood sugar, and even improves digestion. It's one of the simplest and most powerful ways to protect your prostate and your whole body. Habit 3, quality intimacy. Don't focus only on the number of ejaculations. Focus on the quality of your sexual health. Partnered intimacy improves hormones, circulation, and emotional well-being in ways solo stimulation cannot always match. Occasional masturbation is fine, but true protection for your prostate comes from balance, connection, and relaxation. Now here's the bigger picture. These habits don't work in isolation. They're most powerful when combined. Think of them like 3 legs of a stool. Take one away and the balance is shaky. Use all 3 and you build a stable foundation for prostate health, independence, and vitality. And remember, these habits are just the starting point. For complete prostate care, you should also eat a diet rich in tomatoes, cruciferous vegetables, and healthy fats. Maintain a healthy weight to reduce hormonal imbalances. Control blood pressure, blood sugar, and cholesterol. And never skip your annual checkups. A simple PSA blood test and exam can detect problems early when they're easiest to treat. I want to leave you with a challenge. Take out a piece of paper or grab a sticky note and write down these 3 habits. 1. Hydrate smart before 6 p.m. 2. Walk after lunch and dinner. 3. Prioritize quality intimacy. Post it somewhere you'll see every day. Your fridge, your bathroom mirror, your nightstand. Let it be a daily reminder that you're taking control of your health, one small habit at a time. I've seen men in their 70s and 80s adopt these changes and transform their lives. Fewer nighttime trips, better sleep, stronger energy and renewed confidence. And if they can do it, so can you. Your body hasn't forgotten how to thrive. It just needs the right support. If this video helped you, please give it a thumbs up, share it with a friend, and subscribe to this channel for more practical, evidence-based advice on men's health after 50. And in the comments, tell me which of these 3 habits will you start today. Your answer might inspire another man to take action too. And before we close, let me remind you, this video is for educational purposes only. It does not replace medical advice. Every man's body is unique. If you're experiencing pain, significant changes, or have personal concerns, please consult with your healthcare provider. Your well-being deserves personalised care. Thank you for trusting me with your time today. Take care, stay strong, and I'll see you in the next video.